When to see the doctor about your snoring. Many people think that snoring is just a fact of life and that nothing can be done about it. But since not everyone snores, it is clear that something is causing the noise and needs to be investigated. In this way, the snorer can deal with any underlying health issues related to the snoring, and their loved ones will have a better quality of life because they won't have to put up with the noise. What is snoring? Snoring is caused by muscles, soft tissue, and your tongue relaxing as you fall asleep. As they relax, they can start to block off your airway. Every time you breathe in and out through your mouth, the tissues vibrate and you, or anyone sleeping nearby, will hear the typical snoring sound. Who is most likely to snore? There are a number of factors which can contribute as to whether or not a person snores. In many cases, lifestyle changes can help. For example, sleeping on your back tends to create blockages, so training yourself to sleep on your side can help. We are all meant to breathe through our noses, not our mouths, so some people use mouthpieces or chin straps to keep their mouth closed when sleeping. Being overweight, overeating before bed, and using alcohol before bed can all cause the soft tissue to relax further, leading to more snoring. Shedding a few pounds and changing your eating and drinking habits could help. Those with allergies will often have nasal congestion, which forces them to breathe through their mouths. Treating the allergies or using a decongestant can help stop the snoring. But what if you try these lifestyle changes and you are still snoring? Then it might be time to see a doctor. When to see a doctor? It is important to note that often, the person who snores has no idea that they do until they are told by a partner or roommate. In the case of a partner, it is important to get to the bottom of the snoring. Did you always snore and they never really noticed until they started to have trouble sleeping themselves? Did they notice but only gradually become annoyed by it? Or has the snoring got worse? Or, did you only recently start to snore? Working with your partner can help you and your doctor get to the cause of your snoring. Snoring patterns to watch out for. There are particular snoring patterns that can be a warning sign that it is time to visit the doctor. This is case if you snore loudly and heavily. Feel sleepy during the day. Fall asleep at inappropriate times, such as when talking or while eating. Stop breathing, gasp, or choke while sleeping. If any of these patterns are true for you, then you could have a serious issue like sleep apnea, a potentially serious sleep disorder in which you stop breathing during sleep, perhaps hundreds of times a night. It can lead to oxygen deprivation and sleep deprivation. Other warning signs. Even if you don't have sleep apnea, a lack of sound, restful sleep can have other health implications and will certainly impact your quality of life. Look out for being irritable. Not able to concentrate. Feeling down or depressed. Not feeling rested when you get up in the morning. Waking up with a headache in the morning. Looking a bit gray or blue in terms of skin color. Not being able to get through the day without a rest or a nap. Dozing off in front of your computer or TV. Make an appointment. Call to make an appointment and let them know that you want to talk to the doctor about your snoring problem. In this way, they can schedule the correct amount of time for your visit and also refer you to a sleep specialist if needed.